Our next speaker is Dr. Sara Wordingham. Dr. Wordingham attended the Medical College of Wisconsin, graduating in 2009. She subsequently completed internal medicine training at Banner Good Samaritan Medical Center here in Phoenix before specializing in hospice and palliative medicine. She completed her fellowship training in 2013 at Mayo Clinic in Arizona. Her practice focuses on the supportive care of patients with life-limiting illness in the inpatient, outpatient, and hospice settings. She is a member of the Mayo Clinic Ethics, Heart Transplant, and Medical School Admissions Committees. She has a special interest in the augmentation of access and delivery of palliative care to patients with advanced heart failure. She is passionate about maximizing quality of life and optimizing whole person care for patients and loved ones faced with life-limiting conditions. Please welcome Dr. Wordingham.
Hi, everybody. Good afternoon. It is such an honor to be here. You guys are my favorite group to present to. One, because you guys are the front lines of everything I'm going to talk about. Most of my physician colleagues, weren't trained on palliative medicine. It's not a skill set they've developed, but you guys, like I said, are the front lines. So thank you to the course directors for the invitation to be here. Let's go ahead and get started. So I will talk about several things that are off-label. I'll tell you almost everything in palliative medicine is off-label. The title of the talk is Palliative Care Updates. I joke that there's not a lot new in palliative medicine. It's a little bit of an older science, but we still don't do it very well. So we'll talk through lots today. So I'm going to talk to you guys about the role, scope, and philosophy of what I do and also the parts of this that you do every day. And then we're going to carry a case through the whole talk to look at some of those principles. So let's get started with an audience response question right off the bat. Which of the following patients may benefit the least from palliative medicine consultation? A is an 83-year-old gentleman with newly diagnosed AML who's considering chemotherapy. B is a 63-year-old with ischemic cardiomyopathy with severe dyspnea despite maximal medical therapy who wants to continue all disease-directed interventions. C is a 54-year-old with metastatic renal cell and severe cancer-associated pain who takes oral methadone but who's now NPO. And D is a 76-year-old female who's hospitalized for her 4th COPD exacerbation and states that she wants hospice. So the question is, which of these patients would benefit the least? Okay, thank you guys for your responses. So what I'm going to hope to convince you of is that the person who I think would benefit the least from seeing me is D. This patient says that they want hospice, they're clear, that's reasonable. Call a social worker and send them on their